Wow. Okay. We won't give out the details. It stays in between these four walls here that we are independently in four different places as we record this. But congratulations, Jeff. You are now a anointed member of the Illumination Army. The Surgeon General is here. And listen, man, we can't divulge exactly the ceremony that we just did and the initiation that we just did, but just want to say you did great. You did great, Jeff.
Well, I appreciate it. It's HIPAA rights, right? We're making sure it's medical information, so we're keeping it under wraps. And, you know, this was a lot cheaper than my other certifications and things like that, so I didn't have to pay and spend the time with in classrooms and things like that, but it is a title I'll wear with pride.
It's cheaper, but it's way more valuable.
100%.
It's the most valuable.
How many times is this that you've been on the show? Maze, do we know? Is this 3, 4, 5? I mean, it's been, I think you're in that SNL, that club that Tom Hanks and Emma Stone, the 5-star or the 5-time hosts. I think you're right up there. We got to get a banner.
A robe or something for me to wear, you know, something like that, like the SNL cast, something that, you know, to match the bars with the Surgeon General for sure.
Or like the thing with with Billy Joel, you go to the Madison Square Garden and they got like the banners for the championships, the 94 Stanley Cup and the 69-70 championship. And then there's like Billy Joel, 600 sold out shows or whatever it is.
It's the Taylor Swift in LA, isn't it? Didn't she have the banner up in LA?
Yeah, right there next to Kareem's jersey.
I'll take it.
Well, Jeff, we brought you on because there's lots of injury information, news swirling around. We want to get the truth. We want to get down, and we know that this is a very difficult time. I mean, right?
No, yeah, it's a very difficult time. Before we get into details and specifics, we have to start with the question that we ask Jeff every single time. How does this season rank against other seasons? Because it feels like there are more injuries than ever. We have to do that every single time. And then Jeff says, well, actually. So how are we doing this year?
We're up. It's up. It's on pace for a pretty high year. It's I guess you guys can refer back to my original title you guys gave me of the Grim Reaper, right? Like here we are talking about injuries again. And it's the injury rates are about 100 games lost higher at this point. I looked today, through the All-Star, that compressed double week coming out following the All-Star break. And on this date, we're about 100 more games lost than last season. And last season was pretty high. The big thing that is always going to be the outlier is that COVID season, because we had so many games lost to illness that year. Right. So we try to extrapolate some of that, but it's trending upward, which is discouraging, especially with, some of the concessions we've seen and steps forward we've tried to make to help alleviate some of the things. But, I always tell you guys, it's after the season we finally get that good snapshot. The scary thing for me in terms of the numbers is we usually see a spike in this last quarter of the season in terms of games lost as teams start to be more cautious with injuries or starting to turn towards next year. And also the breakdown of fatigue. Guys are starting to get tired as the season progresses and you reach that kind of culmination of the 82-game schedule. So I am unfortunately reporting that they are up at this point, and I'm hoping it's not going to be record high, but it's definitely higher than it was last year, which was a little bit high as well.
Anecdotally, feels like calf strains are up, but maybe that's just to the big name, high profile guys. You got Luka Doncic, you got Giannis Antetokounmpo now. Where do you think the uptick is coming from, and is there anything discernible in the data?
So in the first quarter, there was not with calf strains. Hamstring strains were significantly up in the first quarter of the season, but I ran the numbers following kind of the Giannis-Luka duo there, and calf strains are considerably up this year as well. So, and that's calf related injuries, whether that's a soreness or tightness, anything that's related, linked to the calf. And that includes all the muscles that make up that calf complex. So we're definitely seeing an increase there. And it's hard to predict exactly why. I'm going to go back when the season's over and hopefully look at some of the previous Olympic seasons and see if we had, any kind of big soft tissue spikes following summers coming off of big international competitions kind of thing. But I think we're probably also still seeing some ramifications of the COVID compressed season and then that rush season coming back where it was a little bit compressed schedule. The ripples of that, I don't think we fully understood just yet. And so I think it's going to take, I kind of always said a 5-year window post-COVID is going to be a good snapshot of what we're dealing with, and then keep tracking it as we come out.
You mentioned the Olympics. Any correlation there between some of the guys getting injured and the wear and tear of a shortened off season for them?
I haven't seen anything drastically yet, but some of these guys play internationally, and it's not the Olympics. They play, Eurobasket or some other tournaments. So, you look at some of the top NBA guys, and there hasn't been, Tatum hasn't missed a whole ton. Granted, Tatum didn't play a ton in the Olympics, but you had guys like. LeBron is, and I guess AD now is limited.
Giannis,
but yeah, and Giannis, and so I'd have to try to go back and look at all the rosters because then what you're gonna have to do is, okay, were they on the roster or were they actually playing? Because there are a couple of guys that were on the roster that didn't get a ton of playing time, comparatively speaking to some of the USA counterparts or like a Jokic and those kinds of things.
I did this at like All-Star break, but I always keep track of the playing rate for stars, guys who have been an All-Star or an All-NBA in the previous 3 seasons. And some guys that were at this point, like a week ago, that had 100% play rate, hadn't missed any games. Jared Allen, Pascal Siakam, Chris Paul. That's crazy. Rudy Gobert, Shai Gilgeous-Alexander were at 98%, missed just 1 game. Tyrese Halliburton, Bam Adebayo. So the Anthony Edwards, these guys playing just about every game this season. Jason Tatum, Tyler Hero, Jaren Jackson Jr. But at the bottom, you also have Kawhi Leonard, Joel Embiid, Zion Williamson, DeJounte Murray, Paolo Banchero, Chris Middleton, Luka Doncic, Jimmy Butler, LaMelo Ball, and John Morant's back, but he's missed quite a bit of the season as well. So that's kind of a snapshot of just the star players. But right now, Embiid is probably the biggest story at the moment. Is what do the Sixers do? What you don't think it's
story? I believe a little thing called deep vein thrombosis is the biggest story now.
Yeah,
for sure. Let's do the Embiid one. Let's do the Embiid one first, and we'll say deep vein thrombosis.
So DVT is, we'll get back to that, but the Embiid stuff is alarming for a number of reasons, because we keep having this conversation, it seems like, is that he's dealing with another injury. The meniscus procedure last year hasn't really fully gotten back, and it kind of involves what you just talked about. Team USA playing through the Olympics, and Philly fans were worried, like, hey man, is he going all out for the Olympics, and how will that impact the following season? And this year he's played just 19 games, and the Sixers are 8-11 in those games. He's got a monster extension coming forward for him, and I do think there's some panic in Philly, some panic about Embiid right now.
Sure, and I think that panic has been there basically since he got drafted, right? Like, he missed the seasons with a navicular fracture. They can attribute that to the process, but they saw him what he's capable of when he's healthy. He's an MVP caliber player, right? It's been one thing after another, and some of those are not his fault. The facial fractures, you can't do anything. There's nothing you can do there's no exercise or preventative care for those kinds of things, right? But once a big guy has back, knee, and foot issues, we get worried. Embiid has had all three of those things throughout his career. And this knee has been problematic. He's a big guy. He's had multiple operations on the knee already, and it's continuing to give him problems. And, it sounds like it's lingering effusion, so swelling on the knee, which is causing him movement problems, also probably some pain somewhere mixed in there. And they're just continuing to exhaust their options to figure out what they're going to do, because I think they kind of have to. They've got to run out every kind of ground ball at this point with $192 million extension or whatever it is looming, and to make sure that, they can get some return on that investment that is going to be, and again, you want Joel to be in a good place long-term as well. What's this mean for his quality of life moving forward? Because I stress that's something that needs to be taken into consideration here too, from a standpoint of, he's a big guy and you don't want him limping around the rest of his life.
Jeff, I'm curious. I know this is not exactly something that's easy to track, but as I think about Embiid's injury history, is he the most injured player in NBA history in terms of like the variety of injuries. Broken foot, torn meniscus in both his left and his right knee, orbital fractures multiple times, shoulder, back, hip. I can't remember or recall anyone with a history as varied of serious injuries. We're not talking about like, oh, he had a sprained ankle and a sprained wrist.
As far as the gamut is concerned, I mean, that's a big one. You know, you've had a couple guys do the ACL, Achilles double whammy, guys like DeMarcus Cousins, you know, Klay Thompson. But wide variety, you know, I feel like it always comes back to Kobe. You know, in a lot of ways, Kobe had a ton of different injuries. You know, he just played through them, you know, and that was, you know, part of that Mamba mentality. But, you know, he had finger stuff. He had knee stuff. He had the Achilles. I remember when he was retiring, I did a graphic with, I believe, ESPN, and they sent me a list of injuries. It was like 15 injuries. And they're like, is this everything? I was like, guys, I have like 180 plus injuries for this guy. Like, it was something. And again, because they were tracking the ones that resulted in times lost, you know, versus everything else that he had. You know, he had the rotator cuff. Everyone kind of forgets that. But in that later stage, he tore his rotator cuff in his shoulder and missed a substantial amount of time. So, you know, Kobe's one of the first I kind of always think of. And LeBron's had a ton too, but again, nothing significant that's been as bad. That's a good question because I know there are guys that have had a ton of entries into the database. Oh, yeah, right there. You know, like,
is this your graphic, Jeff? Is this your handwriting?
Maybe. I think that's one of the ones that's really attributed to the times lost. So, you know, I did one where it was, you know, just kind of everything too. But
this one, I don't think this one's just because flu is listed on there. We're not going to give.
He had a viral infection, I mean.
Get out of here with flu, man. Well, yeah,
it's in the database.
Dude, again, to reiterate, Embiid has torn his meniscus 3 times. I didn't even know you could do that. I didn't know you could tear a meniscus and then tear it again.
Yeah, and really it's just all about location. Like I've told you guys before, meniscus injuries are like real estate. You know, the location is going to dictate the recovery. It's going to dictate your treatment options, and you can do it in multiple places. You know, the other one that comes to mind is Blake Griffin. You know, Blake had a lot of meniscus surgeries, and D Rose too. You know, like another guy that has had, you know, kind of had reoccurring meniscus issues in both his knees.
We had a report from the Philadelphia Inquirer, and as Amin reminds me, the reporter that wrote this story for the Inquirer about Embiid is the same one that he pushed in the locker room famously earlier this season that resulted in his suspension, which feels like 6 years ago, by the way, that whole episode, right? So when we're looking at this story from Marcus Hayes, he mentions the same Sixer who made, quote, orbital bone fracture and navicular bone fracture, common phrases in Philadelphia sports lexicon. He said 2 of each, might soon add one of these, and he lists them out. Microfracture surgery, meniscus replacement, low-dose radiation therapy, or even the ominous-sounding osteotomy, but doctors break a bone in the hip to realign the joint to alleviate pressure. One source called the procedures, quote, radical, in light of the mundane injury and surgery that brought Embiid to this point. For some reason, what should have been a routine rehab and a routine return to play has gone horribly wrong, is what Hayes wrote. There's a lot in there, but you, Jeff Stotts, who's been covering injuries and Embiid for quite a long time, what jumped out to you in that paragraph there from the Inquirer?
The term radical, you know, I think at this point they're looking at everything. I think that really what they're saying is everything's on the table, right? Like they're going to look into everything. Does that mean it's likely? Probably not. You know, like looking through my database, like osteotomy, the only person I can think of off the top of my head that has had one was Brooke Lopez. Had one that was with his foot. They realigned the way I think it was his first metatarsal was to take some stress off his 5th metatarsal back when he was having all those foot problems.
Was Big Z also? Didn't Big Z have one?
Maybe he might have had one early on,
like his
earlier
rookie
in his
year.
career.
I want to say,
yeah. So that injury is probably outside the database because database is 05-06. But I have Ilgauskas' career. Now that you say that, I'm thinking like, yeah, it's probably somewhere in there. What is an
osteotomy? Can you explain what that is?
Yeah, so you're talking about like shifting bone in the positioning of bone and potentially transferring osteo is bone, right? So we're talking about changing or removing a piece of bone to help alleviate another area of problems. And so if like what they're suggesting for Embiid would be if there was like a hip malalignment that is putting stress through the knee and into the foot, treating that so that it takes pressure off the knee, which then has a trickle down effect. A lot of times when we talk medicine, it's like a river, right? If you dam up upstream, everything downstream is going to be affected. So if you can alleviate where that blockage, and we'll talk about this later with DVTs, right? If you can alleviate that blockage, the idea is hopefully everything downstream benefits from that. And I think that would be the case. Again, I can't even recall in professional sports someone doing something that drastic. Now, some of the other procedures mentioned, microfracture. Yes, we've heard of that. It's been a while since we've seen a microfracture in the NBA. I think
kind of went away.
Yeah, Pat Bev was, I think, one of the last ones, and that was 2017, 2018, I believe. But we've seen that definitely, everyone knows it from Amari and T-Mac and a couple of other guys that had it in that kind of peak microfracture state. Greg Oden's another guy who's often linked to microfracture.
Alan
but
Houston.
we just don't see it. I mean, Jason Kidd, was one of the success stories. Mashburn, I think, was another one that had it. Yeah. And so there's been some successes. And again, I think the idea is microfracture is not as successful for the style of play now, right? So we've kind of started to go away from it as much, even though it was, something we used predominantly.
I was going to ask, it went from all the rage to now they don't really do it. Why did it go out? I mean, you said it's because style of play. Can you explain what the link is there?
So microfracture itself is a technique. It's not like when we say Tommy John surgery, that's a repair of a specific ligament, right? Like in the elbow. Microfracture is a technique. What the surgeon does is goes in and basically creates tiny breaks in the surface of the cartilage to stimulate blood floating and clotting into the area with the hope of stimulating cartilage growth, because cartilage does not grow very well naturally. It heals very poorly, which is why we have all these problems. This is why arthritis is a thing, right? Because that articular cartilage wears down. But what they were finding out is what was the cartilage that was growing is more like a scab. And if you pick at a scab, it can come off. And I think it was, in a lot of cases, just not as successful as they would have hoped. Now, again, there were successful cases, but you look at some of the more famous, I hate to use the word failure, but it wasn't as effective. It's bigger guys, right? So more load through those knees, more weight through those knees, and it's going to slow things down.
To be fair, because everyone always thinks of Amari, the microfracture actually worked for him. It was the other knee that started giving him problems, and that was what ended up giving him the most issues. The microfracture procedure for him was a success. It's just other
the compensatory thing that
probably trickle down and
And again, it's technique. So it also depends, like we said, about location. Where were you doing the microfracture? Was it on your kneecap? Well, that's got a higher, the underside of the patella, that's got a higher success rate than if it's in one of the weight-bearing structures of the knee where, you're going to have a lot of a high intense load placed through the joint.
So you mentioned location, real estate theory here. Same thing with Wemby, right? Like as soon as I saw the Wemby thing, I had a real from a reporter sense, a real worry that this was Chris Bosh all over again. Was a tall guy, very skilled, just went through a lot of travel. And when Chris Bosh had the chest pains coming out of the All-Star break, I think it was 2016, it was scary because he was like, I just did all this travel and I had these pains and they looked into it and it was a blood clot that had traveled to his lungs. Very scary. Then they tried to treat it, blood thinners, and come back a year later. And then he had an issue in his leg and that was a career ender. And so I was just wondering like, oh no, we're going to have a situation like this with Chris Bosh. But what we learn is that from the San Antonio Spurs report is that this is a shoulder blood clot found in the shoulder, deep vein thrombosis. And that is a different, because of the location of the blood clot, that is a very different issue. And what I understand it to be, and Brian Suter, our friend Brian, explained it to me, is that the comp really is not Chris Bosh. It's more Brandon Ingram. And the way that we talk about blood clots, you have to make that distinction that the way that this blood clot formed or was found is very key to understanding the prognosis going forward, because it seems that something in the shoulder could be more structural, like a bone blocking the traffic, as you were talking about earlier, rather than maybe something that would deal with more something to do with the blood. And so is this, as Brian had pointed out, is it really as simple as, hey, shoulder ones are less severe or less worrisome than ones that are found in the leg or obviously in the lungs?
So a lot of times the key there is a thrombosis is a blood clot, whether it's in your artery or your vein. So we know it's a deep vein thrombosis. So it's in the veins, which the veins return blood to your heart as opposed to arteries that take it away from your heart. Wemby's is likely an effort-induced thrombosis. So it was linked to repetitive motion. I wouldn't be shocked if you hear something like Paget-Schroeder syndrome or something along those. It was just kind of a repetitive motion that led to some blockage of that vein, which led to the development of a clot. As opposed to where clots appear like trauma-induced or following surgery. There's been several cases in the NBA. Udonis Haslem had a clot following a surgery, right? So he got one in his a DVT in his calf.
And that's fairly common in terms of rehab and surgery because you're sedentary, right? And
correct.
And it's possible that it pulls up because there's no activity in there to kind of get the blood moving around, right?
Correct. It's why they put you in compression socks, or full hose following a major surgery. Varejao had one following surgery. Tyreek Evans had one following a knee surgery. So, and these guys are big, and they're laying there. So, a lot of hospitals will put like true compression activated devices that will squeeze your calves for you while you're laying in bed so that blood is continuing, because you're fighting gravity, right? You're fighting gravity that as it pulls, when you move your legs, your calf helps, the calf muscles help that with that venous return. So the muscles kind of act like a milking system and milk that vein, because you're fighting gravity, milk that blood back towards the heart. And so in Wemby's case, again, we're talking about an upper extremity. So it's not the result of something. He didn't have a surgery and now we're having it. And it doesn't, they keep saying, the key word for me with Wemby is they keep saying it's an isolated incident. It does not appear to be linked to some underlying genetic issue. Doesn't have a clotting factor that's causing the problem. And that's exactly what happened with Brandon Ingram. Is he had this DVT in his shoulder and he ended up having thoracic outlet decompression surgery, where they actually remove the compression site. So they take out the first rib, the scalene muscles, and sometimes you have like an extra rib in your neck, a cervical rib. They'll take that out if that's there. And
your ribs go all the way up. This is a dumb question, but your ribs go up all the way to your neck. This is weird.
So every thoracic vertebrae of your spine has a rib connected to it. And then, so if you go to the back of your neck and you can feel your C7 spine, like it's the one if you kind of bend down and it'll poke out, that's your C7. Yeah. Go down one more, that's your T1, and that's going to have a rib. It comes all the way right underneath your collarbone. And it's like, you can kind of feel it if you follow your sternum, and right there, you've got a rib all the way up there. So what happens is there's a big bundle of nerves and blood vessels that come from the neck down into the upper extremity. And if you've heard of, we've heard of neurogenic thoracic outlet syndrome with Markel Fultz. So the nerves were getting pinched in that area. This is more of a vascular impingement. So it's a pinching of the blood vessels versus the nerves. Kyle Anderson is another guy who was having some impingement in his shoulder and had decompression surgery. His, I believe, was neurogenic too. It wasn't linked to clotting. So, but Ingram had surgery and has been fine ever since. There's been no problems with that. His surgery was carried out, I think, 2 weeks after the diagnosis, roughly around there. So I haven't heard anything.
He came back and had an all-star season. His first all-star was right after his surgery.
And we haven't heard surgery for Wemby yet, but if they I would not be surprised if they decide that's the best case for him at this point. But like, this is kind of weird, but if you look at Brandon Ingram's build, he's kind of looks like a little mini Wemby, right? Like,
that's what I was going to ask. Like, is that a coincidence that they're skinny guys and they caught this?
I don't think it's something we should be ignoring, right? Like, I think it's worth taking into discussion. Now, again, guys, like when we talk injuries with guys like Zion, Kate Porzingis, and now even with Wemby, these guys are considered the unicorn, the alien for a reason. But they're one of ones. Their bodies are unique. So you're having to examine things on a different scale. Like you just have to take everything into consideration. But if it is truly something like an effort-induced thrombosis, like we believe, it's likely from the repetitive motion of shooting, whether he was in the gym shooting a whole lot, in the games, those kinds of things. Something was getting compressed. The muscles were causing some kind of compression. Can we get that to calm down and then it's going to be fine? Or do we need to do something more proactive like that thoracic outlet decompression surgery?
What are the symptoms? How does it even, because I've read obviously what you wrote about Brandon Ingram. They caught it early. What are the symptoms? How do you catch it? How do you find out that a guy has it in order to be able to take action early?
So some of it is just like localized pain. Like Wemby did say he had some pain in his shoulder. I believe Ingram even said at the time of his, I was having some shoulder pain. In the case of like Kyle Anderson, he reported tingling into his fingers. You know what I mean? Like somewhere downstream.
Right.
I've seen athletes, come in and they've got elbow pain, and we treat the elbow pain and we do everything we can, and it's just not getting any better. And we start doing a more thorough, and it's neurogenic TOS, you know what I mean? But for the clot, you'll also start to note maybe some fatigue as some of the blood flow is restricted. You might actually start reporting some shortness of breath, especially if it's gotten into the lungs. If there's any kind of pulmonary embolism in there, even if it's a small one, you can report shortness of breath, difficulty breathing, not feeling well. I think back to last year's the Thompson twin that had a blood clot. The initial report on him was asthma. I think he was probably, reporting to the training staff, hey, I'm having trouble breathing a little bit. And, maybe it was just exercise. They thought it was just some exercise-induced asthma. Go in for a full, more detailed eval. And it's like, oh, wow, you got, some clots and on those lungs. So let's start the treatment immediately. Because, again, in worst case scenario, it can be life-threatening.
I wonder how many people are just like false diagnosis because, you think about, for instance, my shoulder hurts. I've been shooting a lot. I think all of us would say, overworking it. The muscle's tired or whatever. I don't think the idea that, no, this is something which a lot more insidious would come to mind.
So I think in Wemby's case, I think they were hoping that the break from the All-Star break would cause things to calm down. And it sounds like he was still coming back reporting, hey, my shoulder's still bugging me. I'm still not feeling great. Okay, let's start looking. And there are different tests. Again, I'm Surgeon General, but no MD for sure. There's other things that people can do that they can start tracking those kinds of things to make sure that, hey, is this a clot? Is this something we need to start screening for, and looking into a little bit more in depth?
Speaking of looking into more in depth, I want to know your thoughts on the Luka trade from an injury perspective. I know you're based in North Texas, and this hits home quite a bit for you. But I looked at the trade, and they're saying, hey, Anthony Davis, he's healthier than Luka in the last 2 seasons, and therefore it's a bigger roll of the dice with Luka Doncic, who's 25, and even though Anthony Davis is 32, going to be 32. Luka's a lot more injured, and I feel like there's almost like you've got to dial. You're a producer, and you got to dial super producer. Maybe Anthony Mays can explain it. Just is Anthony Davis more injury prone? Well, I guess prone is not the right word, but more at injury risk than Luka Doncic. And what's more accurate, using career data, previous season data, or last 2 years data? Because I think you get different answers depending on where you're kind of putting those filters.
Well, the filter is you need to look at it all. Like there's no reason you should look at it through a snapshot. There's no reason you shouldn't look at age. There's no reason you shouldn't look at injury history. All those things should come into play to create as most clear of an injury profile of a player. We talked about foot and knee injuries and things like that for big guys, and how I don't love those kinds of things. And you got an older player in Anthony Davis who, to his credit, has last several years been I would say a model of health because he still had injuries, but he's played a lot and he's avoided those big injuries that we saw in New Orleans. but I mean, there's still risk there, right? Like he's had plantar fascia issues. He's had other issues as well. He's had plenty of soft tissue injuries, which are always concerning. And Luka's had some soft tissue injuries, especially with that calf. I mean, he had the one that kept him out of the start of the postseason when they went to the Western Conference Finals. And now he's had this one as well. And I but he's young, but again, you start building an injury profile with his weight, and I know that's been thrown around a lot, but that's a controllable thing, right? You can potentially fix that, and then hopefully put him in a spot where you can, I hate how much we focus on players' weight, especially with Zion and Luka and those kinds of guys. Because I mean, part of Luka doesn't need to be skinny because that's what makes him so effective, right? Like because he's strong. Like Luka's a strong guy, and so he needs to have some weight on it. And again, I think it was Dorian Finney-Smith, right? 260 and dropping triple doubles. Maybe I need to bulk up, kind of thing, right? Like, so the injury profile comparing the two doesn't make sense to me from a standpoint of the Mavs saying, "Hey, we want to move on to a guy with a better injury profile." That doesn't make a lot of sense to me because, but it makes it more what they're more comfortable with. You know what I mean? Like we're more comfortable with these things. And I think it's difficult to separate the potential for Luka without attaching it to that potential supermax deal, right? Like, again, we're seeing that with Joel Embiid right now, right? Like, not only is he missing games, but so much of your cap space is attributed to this guy. So much is there. So I will never understand the trade from a basketball standpoint, but in a fandom standpoint, like I'd explain to my 13-year-old daughter that her favorite player was no longer on the team, and like through tears, he was supposed to be my Dirk, like I'm like I don't know what to tell you, kiddo, like she's heard me talk about Dirk and growing up with that guy for so long, and my son was like, "You can get traded?" I'm like, "Yeah, buddy," like, and he's like, he just didn't understand it, right? You know what I mean? So. That aspect is hard. It's hard for anybody, but injuries, it just doesn't, the math doesn't math great for me, but they clearly felt comfortable with what they saw in AD.
Let me ask this question. Actually, this is a homework assignment for you, Jeff. I don't know if you already tracked this, but if not, I have a theory.
He's a 5-star Illuminarmy general. He can make assignments for the Surgeon General. It's okay. It's okay.
I'm just saying.
The chain of command here is okay.
Little homework assignment. I have a theory that Anthony Davis, while he's been quote unquote healthier the last couple of years because he hasn't missed as many games, he actually leads the league in leaving games due to injury. So starting a game, but not finishing the game, not because it's a blowout, not because he's tired, but because he got hurt. Oh, my shoulder, my ankle, my whatever. I submit to you, no player in the NBA over the last 2 years has left more games due to injury, even if he doesn't miss the next one. So I don't know if that's something that's in your database, leaving games early due to injury.
That's not. That's a variable I haven't accounted for, man. Like that is that's going to be interesting to see if I could even do it. You know what I mean? From a standpoint of like.
Well, here's how I would do it. I would go to the Twitter feeds when they say Anthony Davis has gone to the locker room, do a little query on that. And you could probably find will not return. But even I probably, if you threw that into the stew in a regression analysis, I'd imagine that even if a guy goes to the locker room and returns, that probably over time that adds up to a significant variable, that you have to go to the locker room.
Theoretically, there's a guy who could play 72 games. And we're like, yeah, he was really healthy. He was really durable. But it's like, if you left 60 of them, obviously I'm being facetious, but if you left 60 of them, like, my shoulder, my knee, my hip, my whatever, that has to mean something.
Yeah, I'm going to let you behind the curtain a little bit. What I'm going to do, because I'm going to look at this, is I'm going to go to our good friends at Basketball Reference, right, and look at minutes played. And you can probably see some spikes in there. And that'll be potential for left or did not finish. You know what I mean? So see if there's anything in there.
Tom, you want to be econ nerd and start looking at standard deviations and variance, and if his average minutes is this, and there's like 2 standard deviations of minutes played reduced over there. Something happened right there that you apply that across the entire NBA. You could do that. Man, you've done it in like 15 minutes.
Sounds like deep research, deep search, something for one of these deep AI research, things. Just like
deep research thrombosis.
Wow. There we go. I gotta ask Jeff this, because as a certified athletic trainer, you feel for all these athletic trainers that are dealing with guys who want to play through injury. And I don't know where the buck stops when some of these guys are like, no, I want to play, and you can't do anything about it. Anthony Davis, we were just talking about him, had the adductor strain. And then I think it's come out recently, I'm paraphrasing here, but I think he said, like, maybe I shouldn't have come back so soon. I just wanted to play for the Dallas Mavericks and show out. We had Karl Anthony Towns check himself into the game the other night against the Boston Celtics with Tom Thibodeau. And we had the KD situation in the NBA Finals where it was like, should he be playing? Should he not? And then sooner or later we have Bob Myers crying at the podium because the worst case scenario happened where he tore his Achilles. And
one more example also, Giannis Antetokounmpo, who famously obviously had that injury where we thought, oh, this guy's going to be done, and it came back in the NBA Finals MVP. But I talked to Eric Name last weekend, and he said, like, even this, Giannis on a minutes restriction, Giannis missing games, that was like a real, dude, you're not 25 anymore moment where they had to impress upon him. You have to sit this thing. You have to let it rest and give it some time. So, Tom, back to you.
Yeah, Jeff, what do you do? Like, what is the athletic? Can you give us an example of what the head athletic trainer does? What the job is in the whole system of letting a guy play or not, medically clearing them?
So this is for me. So like you set benchmarks of what you want your players to do. You know what I mean? And those need to be relatively finite, right? In terms of this is what you got to do, especially with certain injuries, right? You need to be able to do this, whether that's a broad jump with no pain. Give me some kind of distance, if we have a baseline test for something on you, can you return to baseline? A lot of my functional, like I make them do functional drills, can you do this? And I don't see you limping, I don't see, are you running, skipping, jumping, hopping, doing all the things you need to do in a game? Because you might feel fine at baseline, but and part of sometimes it's simply the athlete, oh yeah, that doesn't feel good when I make a hard cut. I feel fine now, but as soon as, and that's where the trust and the dialogue between you and the athlete hopefully is established enough that that's a good realization. Okay, I'm not ready to go. You're right. I'm going to listen to you.
You almost want them to say it, right? You're like,
sure.
You want them to come to that realization. Yeah.
But what do we always hear? Oh, if this had been the playoffs, he'd be out there. Well, that means already your return to play protocol has a subjective component to it where it's going to be how the athlete plays. And there's wiggle room, right? So, okay. And look, that's probably the case in a lot of, I've said that. I'm not going to sit here and say I haven't, where, hey, if this were this game, maybe we can have a conversation about coming back, but it's not. So you're going to sit, it's weighing the risk and rewards. You got to present your case as best you can to the higher beings, whether that's a coach, an athletic director, an owner, your athlete themselves, and try to make them understand not only short term, but long term. One of the things I always tell my athletes, I work almost exclusively with female athletes in a high school setting. And I tell them my job is to make sure you walk down the aisle at your wedding, not limp. Like that is my responsibility to you. And I can't let you back in there without potentially risking that. And that for a high school girl, that's perspective, right? Like, oh, okay, maybe we're talking here. You got to find that common ground with your athlete. And that's hard when they're a multi-millionaire and have so much riding on certain things and legacy and all those other things built into it. So you got to hope that, everything you're presenting them. And that's, I think we talked a little about this maybe before, is that's why you seek out 8 or 9 opinions. That's why you do things like that, where you're trying to show them that, hey, it's not just my opinion, it's multiple people, and even if it's, you get that one case where that person's like, well, maybe you should, if you've got 8 or 9 other people backing you up saying, no, really, you shouldn't do this. Maybe that's more helpful. Does that make sense?
Yeah, that makes total sense. When you talk about, for instance, some of those range of motion tests where you have a baseline reading from the beginning of the year, and now we're testing the athlete against those and how close you are to them, is there a margin of error, or do they have to hit that range of motion, that ability to, that broad jump or whatever it is?
I think it depends on the injury. If they're coming back from a specific injury, right? Like if it's something serious like an ACL recovery, like we have markers that our docs will not clear if they don't hit at baseline or better, right? Like there's no wiggle room there. Like you can't even be, a millimeter, 2 centimeters. You know what I mean? You need to be back to where you were. And that's just to reduce the risk of long-term injury or some secondary injury or whatever the case may be. If I'm watching somebody like just do a squat or, some kind of jump, there's no true objective measure. Like I'm not getting out the goniometer and measuring every little joint angle there. We're trying to figure that out. Have I done that before? Sure. We've done that with people, but again, it depends on the injury. If it's a grade 1 ankle sprain, am I going to haggle over a millimeter? Not necessarily, as long as all the other markers are, functionally clear and there's no other hang up somewhere else, or, you try to gather as much subjective and objective information to make the best informed decision. Subjective information is coming from the patient. How are they feeling? What are they, what's their mentality? That what's their mindset? I've had girls and guys for that matter, athletes that have come back and physically they're hitting all the markers like you talked about, where they physically can hit everything, but they are not there in the head, and they're nervous of contact. They're nervous of, they don't trust themselves. And I'm not going to clear you either, and one of the things I'm constantly saying is a return to play does not mean return to action. And so the doctor is giving you clearance to return to play. Great. But you haven't touched the basketball in six months. Now we've got to get you moving to return to action, to actually. So you've been cleared to do basketball specific activities, basically, right? So now we've got to make sure you are ready to go play. And that's the mental game is an underappreciated part of it, but it's a big part of it too.
Well, the mental game, you really showed yourself before coming on the show and what you were able to do during our initiation ceremony. So thank you for, basically proving why you're the Surgeon General of the basketball Illuminati. So you've got it all, man. Thank you for doing that. Appreciate you.
Happy to do it. I survived. I'm excited.
Well, hey, before you go, is there a term on this, Amin, as the 5-star Illuminarmy general? Is there a term? I think this is in perpetuity, right? Surgeon General?
No, it's at the discretion of the higher council, basically. You're in until we decide you're not in anymore.
That's very Jedi Council of you. I mean,